All right, Devin, so Medicare has two parts, right? Part A and Part B. Can you walk us through that?
Sure. Medicare Part A is considered your hospital insurance. So if you're admitted and you go into, let's say, Central State for 3 or 4 days, that bill is going to be covered under Medicare Part A. So with Medicare Part A, if you go into the hospital overnight, there's a deductible of $1,600. So that means if you're in the hospital 1 day, 2 days, or 60 days, your out-of-pocket exposure on that would be $1,600. If you go from the hospital into a skilled care, let's say that you had a stroke and you go from being in the hospital for 6 or 7 days and then you're in skilled care, Medicare will pick up the first 20 days as long as you have been in the hospital for 3 days or longer, at no cost to you, and then there'll be a copay of $200 per day between days 21 and 100. So Medicare Part A, has some other moving parts, but basically it's an overnight hospital stay and skilled care. There are going to be some out-of-pocket costs. That's generally why people will pick up a secondary insurance plan.
Okay, makes sense. And can you tell us about Part B?
Sure. Medicare Part B is considered doctor and outpatient services. A couple of examples of this would be doctor visits, trips to the physical therapist, durable medical equipment like supplies for diabetes, any type of diagnostic testing like x-rays, MRIs, blood draws, even certain procedures that are done outside of a hospital, like at a dermatologist's office, would be covered under Medicare Part B. So Medicare Part B is really important because most of your medical claims will be filed under Medicare Part B.
Okay, so Part A is your hospital stays, and then Part B is everything outside of staying in the hospital.
Minus your drug costs.
Okay, minus the drug costs.
Okay. So Medicare Part B has a monthly premium, and this year, for most people, the monthly premium is going to be $164.90. In a separate video, I'm going to explain why some people might pay more than $164.90, and that's called an income-related monthly adjustment. So after you pay your monthly premium to the government, that $164.90, Medicare has a deductible, and this year, that's going to be $226.
Okay.
After you satisfy the first $226, Medicare is going to kick in, pay 80%, and you're going to be responsible for 20%.
Okay.
So, keeping Medicare simple, we have Part A hospital and Part B medical. We just gave you the highlights. If you have additional questions, anybody on our team can walk you through the differences between Part A and Part B and what the out-of-pocket costs. And again, if you wanted to come in for an appointment, we would tell you how the right insurance will help fill in these gaps. Because as we know, Medicare doesn't cover all of your medical expenses.
Or you can give us a call at the number provided below or email us.